In 2011, I first started experiencing some pain in my lower back, a level of 1 to 10. Mine was probably at a 15 at that point. I had never experienced that kind of pain in my life. It was endometriosis.
Endometriosis is a condition where cells that normally line the inside of the uterus actually implant themselves in other parts of a patient's abdomen, pelvis, really can be almost anywhere.
It's tissue very similar to what comes out with the period, and it causes inflammation, pain, scar tissue.
It is a benign condition, most commonly diagnosed between the ages of 25 to 45, but it can really happen after the first period, and it can last up until menopause.
This is really a common condition affecting nearly 10% of women. It can be a really debilitating chronic disease. The patient can be asymptomatic, but certainly most commonly it's pain. And that's typically pelvic pain, can be associated or worse during the menstrual period.
Very heavy menstrual cycles, pain with intercourse.
They experience some bloating, and they may have problems with their bowel and bladder as well.
It's a progressive condition and a chronic condition. Eventually, the patients may have pain all the time.
Classically, we'll see symptoms develop later on in the 20s, but it can continue all the way through the 40s as well. There's a pretty strong behavior or psychosocial element to endometriosis.
Because it's many years of a woman's life, we do have to be very conscious about how this can affect their quality of life.
Where does it come from? There are multiple different theories. The most common is from what we call retrograde menstruation. Probably all women, during their menstruation, there is some backflow of blood and the tissue into the inside of the pelvis through the fallopian tubes. How does it get to other places in the body? We think that there's also lymphatic spread of endometriosis.
Technically, it's diagnosed at the time of surgery, usually by laparoscopy. We see the lesions, move the lesions, send it off to the lab where they look at it under the microscope to see actual endometrial glands and stroma.
20 to 30% of the time, even though we don't see disease with our eyes, microscopically there's still endometriosis.
About 30 to 50% of our patients who are infertile have endometriosis.
Unfortunately, patients can go years and go to multiple different doctors before their endometriosis is diagnosed.
Fortunately, today there are multiple different treatment options and it's not just surgery. Most of our approaches on the medical treatment path is really about hormonal management and suppressing menstruation. Even starting birth control pill or continuous birth control, progesterone IUD is commonly used as well. Surgical treatment for endometriosis is traditionally done with minimally invasive surgery, either laparoscopic or laparoscopic robotic, a robot which we actually are still doing the surgery, but we have a little bit better control and visualization using robotics.
Most of the time we see improvement in the pain and the quality of life. The studies say 7 out of 10 times the patients have resolution of their pain, but even in the 30% that don't, they still have great improvement in their quality of life.
Even though we may be successful with surgery, this will often recur.
2011, the endometriosis started encroaching on different areas. After the surgery, I was reassured that it wouldn't grow back. 2017, same exact situation. 2022, I was informed that the endometriosis had returned and now it was stage 4. Luckily, I came across Dr. Achalanu's name and Northwell, and that's when I felt like my life changed. For the first time ever, I felt like I had a doctor who was actually listening to my story, who approached me with curiosity, asked me about the different facets of my life. Dealing with stage 4 endometriosis, it seemed like there weren't as many options, but Dr. Achalanu presented me with 5 different options. We carefully went through each one. We consulted as a team with my new rheumatologist and my new primary care physician. I actually did end up getting a total hysterectomy. Dr. Achalanu and his team were there every single day to ensure that I was doing okay, to make sure that I got the right treatment, that the right doctors were in place to help with any of the complications that I was experiencing, and that I was getting the best care possible. And for that reason, I will always trust Northwell, and it really did change my life.
At Northwell, we've evolved the treatment of endometriosis, whereas it used to be that you have a surgeon who goes in, sees disease, removes disease, and that's pretty much where it would end. Nowadays, we know endometriosis treatment is so much more than surgery. Treatment really depends on individualized care and then providing whatever that patient may need.
our endometriosis program at Northwell. With our growing division of minimally invasive surgery and other experts in both surgical treatment and non-invasive treatment, we've really put together a comprehensive program understanding that care for a patient with endometriosis requires a village. Team that's comfortable and understand the full gamut of the patient and the treatment options, and understanding that there's not one magic treatment for this condition. Northwell is differentiating itself through research. The ROSE study at Northwell's Feinstein Institutes for Medical Research is developing the first true non-invasive diagnostic test for endometriosis. The study has found a way to diagnose a patient with endometriosis from only a sample of menstrual blood.
For a patient that is having severe pain and is suspicious that she might have endometriosis, I would recommend for her to advocate for herself.
You know your body better than anybody else, and if you're experiencing pain and you're constantly being told that, no, let's just put you on muscle relaxants or let's get you some painkillers, keep asking to be seen and to be heard and to be cared for, because that will make a difference. If I were to go back in time, the only thing that I would have done differently is approach Northwell sooner.